Hello friends, so this is lecture number 1 of the chapter Epidemiology of Communicable Diseases, and today we are going to learn about measles. We will discuss about its causative factors, host factor and environmental factor along with the diagnosis and treatment. I have already uploaded videos on topics like ASHA, ICDS, PHC and many more. You can check them out, the link is given in the description section below. So with this, let's get started. Now, measles is a highly contagious viral disease. It remains an important cause of death among young children globally. It is an endemic disease. Now, what is endemic? It refers to the constant presence of a disease or infectious agent within a given geographic area or population group without importation from outside. It may also refer to the usual or expected frequency of disease within such area or population group. Now, an epidemic can occur if about 40% of the population is susceptible. If the virus enters a community that has never been exposed before, almost 90% of the people will develop measles. It is that contagious. Let us see the agent factor for measles. Now, the causative organism is an RNA paramyxovirus and there is only one serotype. It doesn't survive long outside the body. The source of infection is always a case of measles itself. The infective material is secretions from the nose, throat, and the respiratory tract. The person is infectious during both the prodromal phase and the eruptive phase, 4 days before and 4 days after the appearance of rash. Now let us see the host factor. It mainly affects children between 6 months and 3 years, but nowadays we see cases up to 5 years. Both boys and girls are equally affected. Once the child is infected with measles, he will get lifelong immunity. Maternal antibodies protect the babies up to around 6 months of age. Now the severity increases in some conditions like malnutrition, especially vitamin A deficiency. The mortality can be 400 times higher. Second could be infant and adult over 30 years have more severe disease. And third, in immunocompromised patients like those with AIDS can also have fatal complications. Let us see now the environmental factor. Now, measles has a seasonal trend. In tropical zones, it is common during the dry season. In temperate zone, it is during the winter season. In India, most epidemic occur from January to April. It is also more common in people from low socioeconomic background. The mode of transmission, it spreads by droplet infection. The portal of entry is the respiratory tract. The incubation period of measles is 10 to 14 days. Usually fever appears around day 10 and the rash appears around day 14 after the exposure. Now let us see the clinical features of measles. Now measles has 3 stages. First is the prodromal stage, second is the eruptive stage, and third is the post-measles stage. It is 10 to 14 days after the infection. It is categorized by fever, cough, coryza, that is sneezing, nasal discharge, red watery eyes, and photophobia. Also, there is presence of coplic spots, which are tiny bluish white spots inside the mouth which appear a day or two before the rash. Vomiting or diarrhea can also occur. Second is the eruptive stage. Typical dusky red macular or maculopapular rash begin from behind the ear and spread rapidly in a few hours over the face and the neck and extend down the body, reaching the lower extremities in 2 to 3 days. The rash is discrete but can also become confluent and blotchy. In the next 3 to 4 days, the rash and the fever disappear. Rash disappear in the same order in which it appeared. A brownish discoloration is left behind that persists for 2 months or more. Third is the post-measles stage, in which the child loses weight and remain weak for many days. Growth retardation, diarrhea, cancrum oris, pyogenic infection, candidiasis, reactivation of pulmonary TB can occur. The diagnosis is mainly clinical. It is based on the typical rash and coplic spots with fever, cough, and red eyes. Lab tests are rarely needed except where measles is uncommon. The test includes IgM antibody detection and RT-PCR for viral RNA from throat swabs, oral fluid, or urine. There is no specific antiviral. Treatment is usually supportive. Treatment of common symptoms: fever, cough, nasal congestion or rhinorrhea, conjunctivitis, sore mouth. Second is nutritional support. Breastfeeding should be encouraged. Oral rehydration solution is given. Vitamin A is given on day 1 and day 2, and if signs of vitamin A deficiencies are present, then one more dose is given on day 14. About 30% of measles cases develop complications such as otitis media, laryngotracheobronchitis, diarrhea, pneumonia, post-infectious encephalitis or subacute sclerosing panencephalitis, acute progressive encephalitis and giant cell pneumonia, especially in immunocompromised patient. Persistent diarrhea with protein losing enteropathy can also occur. The case fatality rate is about 3 to 6% but can reach 30% in developing countries. In pregnancy, measles can cause spontaneous abortion or premature delivery. So now let us see how can we prevent measles. So measles can be prevented with vaccination with 2 doses of measles vaccine combined with rubella at 9 months of age and 16 to 24 months. It is given subcutaneously 0.5 ml. Early diagnosis and treatment is important along with the notification of diseases. Isolation of case for a week after the onset of rash is important. Susceptible contact between 9 to 12 months of age can be vaccinated within 3 days of exposure, and immunoglobulins within 3 to 4 days of exposure is given. A child who receives only immunoglobulin should be given measles vaccine 8 to 12 weeks later. So with this we have come to an end of this lecture. If you found this video helpful, like it, share it and subscribe for more.